You have to ask. Like even when they
But
come
the
to the
person is afar.
hospital.
How do I ask? No, the person is far, and I'm telling you, go give this. So I say, give it to the person.
Yeah,
Okay, what if
you
I want
just
to use
have
a different
to
word?
use that. You
Give it to
can't.
the human being. Okay, what if the person doesn't? What if the person I'm talking about doesn't identify as a human being, but that's a lizard? What happens then? Give it to the lizard. Oh no, how do you know it's a lizard? No, she's actually lizard's egg. Hi everyone, I'm Dr. Adolfo Sinyako, and I'm here with
Dr. Phoebe Bonyo.
And today we'll be reacting to a video that is titled Doctors and Psychotherapists.
Butchers and Liars.
It's a video by a professor called Dr. Jordan B. Peterson, and he is a clinical psychologist. Okay, so I'll just read a little bit about him on his YouTube page, but he has a website which you can visit to find more about him, and you can also watch his YouTube videos to know more about him. And so, Dr. Jordan B. Peterson is a Canadian professor of psychology and clinical psychologist, YouTube personality, best-selling author, and the host of the #1 education podcast, the Jordan B. Peterson podcast. Watch the entirety of, so you can watch his videos. He also joined Daily Wire, so you can watch from there. He has written a few books. He's written 12 Rules for Life, and
That's the recent one that just came out. Right?
That's 12 More Rules for Life, the antidotes to chaos.
Okay.
So he has 2 books that are about 12 rules for life. And apart from that, he wrote a paper called Maps of Meaning, and he made it into like a lecture series. He's also made it into I think he made it into a book, which has really sold. Yeah. So for those of you who don't know, gender and sexuality has been a very hot topic and has been a very debatable topic in recent years, especially in the Americas. And Dr. Jordan Peterson is someone who has been really outspoken about it, and he has been against some of the views of people who view themselves as liberal, but he believes using that as a guise or a facade to actually fulfill their personal agendas. And so one of the main ways, or one of the main things that made him so famous, was his objection to a bill in the Canadian Parliament called Bill C-70, which he believed was compelling speech. Yeah. And do you have anything to add to this whole gender?
We have couple of sexual preferences. We have LGBTQIA 2S+. You see, so that's basically lesbian, gay, bisexual, transgender, queer, intersex, asexual, two spirits, and there are even more. Yeah, basically.
So I hope that in the following times to come, right, we'll be able to really talk about these things in depth, both on the sociological front, the religious front, the psychological front, the scientific front. But today we're just going to focus on this part, which is what he this piece he wrote, and actually he published in the Telegraph. So we'll focus on this for today, and in subsequent videos we'll break down most of these things and react to various videos and not just his. Yeah. So let's go.
Hello, everyone. I'm in Bucharest, Romania, about 2/3 of the way through the European leg of my Beyond Order tour, which seems to be going very nicely. I've spent some time over the last few weeks, it's June 16th, 2022, by the way, writing a couple of articles for the Telegraph, one of which I'm going to read to you today, called Butchers and Liars. We are sacrificing our children on the altar of a malicious far-left ideology. The medical profession is crumbling in response to radical transgender activists. There's good evidence that many ancient societies sacrificed children to their gods. Parents in ancient Phoenician colonies in Carthage, Sicily, Sardinia, and Malta slew their offspring prior to cremating them, hoping that the gods would hear their voices and bless them. We are rightly appalled by this, though sometimes I wonder whether we understand child sacrifice far more than we'd like to admit. I saw a video the other day featuring an American surgeon bragging that he had performed more than 3,000 double mastectomies on young women who had paid for.
Okay, so we have to address, like, for those people who don't understand what mastectomy
Yes. Okay.
actually
So
means. So
before we go into the scientific part, right? The way he starts the video,
yeah,
he goes like, we are sacrificing our children on an altar, right? And he's comparing it to those days where child sacrifice and human sacrifice was normal.
Yeah.
And today we say that, no, these things, when it comes to sacrificing human beings, it's wrong. It's not moral, right? However, you've got something happening which he compares to child sacrifice, right?
Yeah.
And what he's saying is, it's being done by a group of people who are, he says, radical transgender activists. So from the way he's speaking, he's trying to say, okay, you guys are saying you're transgender and everything, but you've taken it to a point where it's almost as if you are forcing people to kind of accept what you think and what you believe to be true and going through with it. Like you're seeing it through by sacrificing children. So how are they sacrificing children? Then we come to this mastectomy thing.
Yeah,
So what is
mastectomy basically means the removal of the breast. Yeah, surgically removing the breast. It can be partially removal or the whole removal, complete removal. Yeah, and mastectomy is usually done with on patients with breast cancer. So patients who have breast cancer, most of them, they're being referred or they're being advised to have mastectomy.
Okay.
Yeah. So basically, it's just the removal of breast.
Okay, so I believe as it goes, he's going to say all those things, like some other things that also relate to what you're saying.
Yeah.
Now, you don't cut off any part of the human body if it is not, number one, doing any harm to the individual. If it is not impeding the progress of the person's life, or if it's not reducing the person's quality of life. And you don't cut it off if it is not going to improve the person's quality of life.
Exactly.
You understand?
Yeah.
So first of all, it has to be something that is actively hurting the person. Normal breasts are breasts. They are healthy. According to medicine that we both practice, there's no need to remove it unless it has cancer. It has some sort of maybe infection like flesh-eating bacteria, which can affect the whole body, or some other disease that is so dangerous that if it doesn't come off, the person will literally die.
Exactly. Yeah.
Who died because they had healthy breasts? So let's continue on that front. So he's saying, like, sometimes he wonders that maybe we actually understand child sacrifice way less than we actually think we do. Because what you people are doing is akin to child sacrifice, but you guys are pointing fingers at the people of the old and saying what they were doing was wrong.
It was wrong. Yeah, exactly.
Right? So maybe we don't actually understand it as well as we think we do. So he says he remembers that he saw a video.
American surgeon bragging Oh, sometimes I wonder whether we understand child sacrifice far more than we'd like to admit. I saw a video the other day featuring an American surgeon bragging that he had performed more than 3,000 double mastectomies on young women who had paid for gender reassignment. Individuals confused, one might say encouraged, by those who profit from it into believing that their adolescent emotional trials can be cured and happiness reign forever.
So check this out. He's saying, you guys, right? You're a group of people who are kind of telling kids, adolescents, not old people, but adolescents. You're telling them, see, you're feeling depressed, you're feeling unhappy, you're feeling all these negative emotions. Well, maybe you're not in the right body. Have you thought about that? And we all know, even especially in medicine, that the brain of a young person is nowhere as mature. You know, some studies have even shown that a person matures after 30 years old. So someone who doesn't even know the world they live in is damn sure, like they're 100% sure that I'm in the wrong body.
And most of them happen to be less than 18 years old.
And your solution to that is, hey, let me cut off your breast. Let me remove your penis. And you'll feel better. And that's the promise they give them. You're not going to feel depressed. You're not going to feel down, because once you are in the right body, everything will be solved.
But we are forgetting all the things that go on after the surgery, because cutting an underage, like, okay, because they are most of them are less than 18 years old. So the pain of surgery, and we have infection after surgery.
Surgery itself carries a risk.
And then the surgery complications. We're all forgetting about all those things by allowing an underage to go and perform those
and one thing he
crucial
says is
surgeries.
that, like one might say, these people are even doing it for profit. Do you get it? Because the surgery is not cheap. And a surgeon is bragging about it that, see, I did double mastectomies for more than 3,000 people. Double mastectomies.
Double.
If they subject themselves to this brutal practice, and it is brutal, a process that often includes not only the aforementioned mastectomies, but other appalling surgical processes. Orchiectomy, that's castration in blunter language.
Yeah, so for women, what they do is they cut off the breast.
The mastectomy part of it.
And then orchiectomy is for the guys, where they remove the whole penile structure. They remove all of that and also remove the testes, scrotum, everything out.
The removal of the uterus, the demolition of the musculature of the forearm to make what is not a penis but must be referred to as such.
And they take the muscles of your arm. They take the muscles of your arm, then they will surgically make it in such a way that it looks like a penis, and they put it for the woman. So they remove her uterus and put that. And for the man, they will take your penis. When they cut it off, they will leave, sometimes they leave a stump of it, and then they turn it inside out
to look like a
vagina. And then they said, oh, now you will not be depressed anymore because we cut off the thing that you were born with.
All of that. For someone purporting to be a physician to perform this on children, to me at least, seems like something worthy of a prison sentence.
Children.
Whatever happened to the doctrine expressed by the ancient language as primum non nocere? First, do no harm. The Hippocratic Oath has been replaced by a delusion, a belief that can be summarized as, by blocking the puberty of children and then surgically altering them, we are only restoring what is theirs by right. A child's feelings are the final arbiters of their reproductive destiny. And any attempt to contest their gender identity risks increasing their proclivity for suicide.
So, so someone goes to med school for 6 years, does residency, does internship, does residency, does specialization, does fellowship, and then so you can add it up until it reaches maybe 13 years, 14 years, 18 years, right? When they finish with all that, and then they have to examine someone who says, I'm depressed. Then we tell the child that whatever it is that I learned about the human body, the hormones I learned, the anatomy I learned, the physiology I learned, I think all that is not important. What is important is how you feel right now. You know, if you feel depressed, maybe it's because you are actually a man, not a woman.
And I also feel like peer pressure has added into all these.
What is even more annoying, or what is even more painful, is that any attempt, like if you try to tell the person, maybe you should think about it, or maybe that's not the issue. They say you are driving the person to commit suicide. And so you are committing violence on a transgender person, which is totally unfair.
Tricky. So all they're trying to say is that you're not allowed to say what you think. Like, okay, if I think
even though you are a trained professional who knows more about the human body, who knows more about how it functions than someone who just has feelings, if you talk about it, you are the one that should rather be criticized, and not the person who doesn't know what they are going through and needs education, or needs proper orientation, needs some sort of talk, a dialogue. Not that maybe you force on them, no, you are a guy, or no, you are this. No. Have an attempt to have the conversation automatically puts you in the category of people who hate it. Do you understand? It's not like when you say I hate it, that's when people say you hate it. No. You try to have a conversation to understand what the person is going through. Imagine a patient came to you and told you, doctor, I'm having a myocardial infarction. If you tell them, well, it might not be a myocardial infarction, it might be a pulmonary embolism, straight away, you are discriminating. Can you imagine if that's what happened in the hospital? Doctor, I'm having myocardial infarction. Are you a doctor? No. Did you go to med school? No. What do you know about myocardial infarction? I know that it's chest pain. Well, so is pulmonary embolism.
But I feel like some doctors are caught up in the middle. So like they don't know what exactly to tell you. Like when you go and say, okay,
exactly.
I want to remove my breast. I want to look like a guy. I want to go through the hormonal process, But so they're just caught up in the middle. They don't know what to tell you. So they don't want to be like biased upon their own.
They don't want to be labeled. You are the person who hates us.
Like you are the one who is preventing me from
being myself.
Yes, being myself, and like so reaching my goal.
You hate me. You are I feel like it's not right.
Most doctors are just like, okay, you want this? Okay,
let me just do it for you.
Or they just avoid all the and all the okay, you hate us, all the anti-transgender.
There's a saying that says what? It says, the bad people flourish, or evil flourishes when good men sit by and do nothing. Do you understand? Because everybody is pointing fingers at anyone who tries to understand what is going on, and anyone who tries to have an opinion that is not the same as what these guys are pushing. And so the moment you do that, they point fingers at you. And other people who are thinking, no, this is not right, they can't say anything, because if they are to say something,
like most people are afraid, because I've read articles where people are saying that once they came out and started talking against it, they lose their jobs.
Yeah.
You see, like people come and give them hate comments. So most people don't want to undergo through all
those things. So they just say, okay, you guys just do what you want to do.
Do what you want.
But it's dangerous.
It is dangerous. Really dangerous. We have
for us to encourage
and we have to say
this kind of behavior. So What he's saying, you see, he says that like they're saying, um, um, you whenever you try to talk to a kid about their gender identity and all that, you push them towards suicidal ideation, which is not true. It's just not true.
Attempt to contest their gender identity risks increasing their proclivity for suicide. Lies. 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 Then, butchery. Changing standards. Psychologists, those in my own personal field of medicine, have also surrendered to this groupthink. The American Psychological Association's Task Force on Guidelines for Psychological Practice with Transgender and Gender Nonconforming People, TGNC, insist that psychologists and other professional counselors offer trans-affirmative care, starting with such niceties as displaying TGNC affirmative resources in waiting areas. Practitioners are also asked to examine how their language, e.g., use of incorrect pronouns and names, may reinforce the gender binary in overt or subtle and unintentional ways.
Tricky. Very
For me,
tricky.
for me, it's not tricky. It's just annoying. Let me tell you. For me personally, it's not tricky. It's annoying. Check this out. First of all, they said you have to treat the people trans-affirmative in trans-affirmative way. Do you know what that means? It means that, hey, you have to accept, number one, that when someone says that they are in the wrong body, automatically they are in the wrong body. Number two, not only do you have to accept it, you have to support the person. And science is one field that has always tried as much as possible to remain in the middle. What do I mean by that? Science operates by facts. Meaning, is there something as transgender? Well, let's research it. Do you understand? Do people feel like they're in the wrong bodies? Well, what is the reason? I'm talking from a scientific point of view, not a religious point of view. Why do people feel like they're in the wrong body? Is there something physically, physiologically? What are the processes that occur that lead to that? Let's try to understand it. But no. You don't understand it. You have to support it and put trans affirmative, TGNC, whatever it is, affirmative things in the waiting rooms by force. Like you have to do it. And not just that, they are now telling you that as a doctor, when a patient, because this whole thing about pronouns is already in disarray. You understand? The first thing is, in science, this pronoun stuff, is it valid? That's the first thing you need to ask yourself, because if someone refers to you as Phoebe, that is the name given to you by your parents, right? Which you can change, and then whatever name it is you have it. Now, if someone refers to you as that human being, can you say, no, I'm a goat? So somebody referring to you as a human being is not dependent on what you want to be called. Do you understand?
Yeah.
So
exactly.
you can tell people, call me Sheila. Like, I'm a guy. But I can tell you, call me Sheila, and you have to call me Sheila because it's my name. But I can't tell you, call me a shark. Why? Because I identify as a shark. No, you are called those things based on certain features that you possess. Right? So that's what I'm saying. This pronouns thing, is it valid scientifically? Do you get it? Because we name the way all these naming stuff even came out, kingdom, order, phylum, down up to species. Why did they have to come up with such a classification? So that we can all, under one common language, recognize things for what they are, and then those things, if they have the ability, can tell us, oh no, I'm a human being, but call me Adolphus. That's what I have power over. But if I have all the features of a man and I say I identify as a woman, well, we haven't researched why exactly it is that some people who are born male feel like they are female. So up until this point, someone who has the features of a man is called a man. But for it to be accepted that, oh, someone who has the features of a man can be called a woman, then what is a man?
Then we lose the point.
And what a man is cannot be subjective. That's my point. What a man is cannot be subjective. Come up with a different classification. Something else that helps us classify. Because then if you see someone walking from in a distance and you have never talked to the person, how will you call the person? That lady or that human being?
I feel like that's where we're heading nowadays.
Yes,
Because you
and-
can't just assume
Oh,
the way
that
the
person
person
is a
looks
lady.
like. You're like, okay, you have to ask. Like even when they
But
come
the
to the
person is
hospital.
afar. How do I ask? No, the person is far. And I'm telling you, go give this. So I say, give it to the person.
To the yeah,
Okay,
you,
what if
you
I want
just
to use
have
a different
to
word?
use that. You
Give
can't.
it to the human being. Okay, what if the person doesn't? What if the person I'm talking about doesn't identify as a human being, but that's a lizard? What happens then? Give it to the lizard. Oh no, how do you know it's a lizard? No, she's actually lizard's egg.